Welcome to the scanning technique section of our training module. Here we will tackle the technique involved in locating, evaluating, measuring the gallbladder and the biliary ducts. Gallbladder imaging can sometimes be challenging for a number of reasons. It is typically behind the subcostal margin, making access difficult. It may be contracted, especially in emergency patients without proper preparation, proper fasting. The gallbladder can also be obscured by bowel gas. And as I mentioned before, it can be located in multiple locations. Knowledge of these challenging situations may help in avoiding frustration while uh, finding the gallbladder during ultrasound. Initial surveys done supine with the transducer oriented parasagittally and slightly oblique below the subcostal margin. This will image the gallbladder in its long axis. One must then gently fan the transducer left and right, as well as rock the handle, cephalad, and caudad. This should be done to locate and image the gallbladder. To help in bringing down a high-set gallbladder, one may ask the patient to hold inspiration for a few seconds. This may be done or repeated several times as needed. Uh, Overall, with this initial approach, the gallbladder in most patients would be imaged properly already. If there is difficulty, ask the patient to assume a left lateral decubitus position. This would again help push the bowels away and move the gallbladder inferiorly, allowing for easier imaging. Position the transducer in the parasagittal orientation along the subcostal margin. Again, fanning and then rocking the probe while looking for the gallbladder. One would probably need to orient the probe a little obliquely to align with the longitudinal axis of the gallbladder. When the transabdominal approach fails, the lateral intercostal approach could also be used, especially in obese patients or in patients with inadequate fasting. I, for one, frequently use this approach. One just has to be mindful of the ribs surrounding the intercostal spaces. You must ensure that the probe is oriented along the intercostal space to image the gallbladder adequately. Intercostal views may be obtained with the patient in the supine or in the lateral decubitus position. The intercostal approach is very helpful when the gallbladder is positioned under the ribs and or the patient is unable to take a deep breath. Many emergency providers like using intercostal views because the position of the transducer is very similar to that being used when visualizing Morrison's pouch during the FAST exam. Sonographic landmarks may be of use to locate the gallbladder. The most important of which for the gallbladder is the main lobar fissure. This is marked by the arrow over here. Now, this separates the functional right and left lobes of the liver and can be seen on ultrasound as a linear echogenic structure. It connects the right portal vein to the gallbladder neck. This is the most reliable landmark for locating the gallbladder. Now, in this image, the star is the gallbladder, the chevron indicates the portal vein. Now, also seen here, anterior to the portal vein are the hepatic artery and the common bile duct, which we will discuss a little bit later. This is the gallbladder imaged on its long axis, imaged transabdominally on the left lateral decubitus and the supine positions. The portal vein is seen here connected by the main lobar fissure to the gallbladder. In this long axis imaging of the gallbladder, notice how the transducer is positioned. The transducer is obliquely oriented along the parasagittal plane. It is also rocked with the angle angled caudally. This allows the probe to peak underneath the subcostal margin. Fanning of the probe should then be done to completely image the gallbladder. The main lobar fissure here and the portal vein are again seen. Landmarks that can be used to locate the gallbladder neck if initial imaging proves to be difficult. After seeing the gallbladder in the sagittal plane, one can now rotate the probe 90 degrees counterclockwise to scan the transverse plane. This is the typical transverse view image that is obtained with this probe orientation. The gallbladder is the most anterior anechoic structure. And next to it, posterior medially, is the vena cava. The IVC and the right kidney are also important landmarks here to help with localization of the gallbladder. After gallbladder identification, one may fan through it from the neck to the fundus. The following slides are some video examples. To image the gallbladder using the transabdominal approach, place the probe oriented in the parasagittal plane below the subcostal margin, and the gallbladder can be readily identified. Turn the probe obliquely to image the gallbladder in its long axis. Then fan the transducer from side to side to scan for pathology. The transducer is then rotated 90 degrees to image the gallbladder in the transverse plane. Fan the probe to scan the gallbladder fundus down to the neck. To locate the gallbladder through the lateral intercostal approach, you start by placing the probe on a low intercostal space. The liver and the right kidney are seen, and then you move the probe anteromedially along the rib cage until the gallbladder is visualized. This is a patient with calculus cholecystitis. At least 2 gallstones are seen, and the thickened gallbladder wall is marked. To measure the wall, one must freeze the image and apply the caliper. The caliper shows a thickened gallbladder wall at 4 millimeters. The best area to measure for gallbladder wall thickness would be the anterior wall. This is the Mickey Mouse sign. The right ear is the common bile duct, the portal vein is the face, and the hepatic artery is the left ear. In this example, we image the common bile duct on its long axis using the portal vein as a landmark. The portal vein is seen here on its long axis, and directly above and parallel to it, there is an echogenic tubular structure. This is the common bile duct. One can confirm that this is the CBD by using color flow Doppler. And it shows that there is no flow within the supposed CBD. Thank you. And this concludes this lecture about scanning technique. The next section will show different examples of pathologies in the gallbladder and biliary system, as well as examples of pathologies in the liver.